I'm glad to be here today to tell you about our studies looking at the possible role of waterborne agrochemicals in particular in the high incidence of pediatric cancer in Nebraska. This is a study that was started, I'll say 8 years ago, by a casual conversation between one of our study members, whom some of you know, Alan Kolak, who used to be at UNO and UNMC and is now at the University of Idaho. He's an aquatic toxicologist, for those of you who don't know him, and Don Coulter, who's the pediatric oncologist at UNMC, who sees most of the pediatric cancer patients in Nebraska. And Don was lamenting the fact that the incidence in Nebraska is so high, and he wished he understood why. So Alan and he were talking, and they said, well, maybe it's agrochemicals in Nebraska waterways. And then Alan said, we could study that. And so that's how this group came together. It's an intercampus group that also includes Shannon Bartout-Hunt from the College of Engineering here, and Yusong Lee from the same department, and then also Carrie Weber from IANR. So let me tell you about, and in addition, Jesse Bell, who's going from the Department of Environmental, Agricultural, and Occupational Health in the College of Public Health at UNMC, which is the department I normally chair, except that right now I'm the interim chair of health promotion because we're searching for a new health promotions chair. So let me tell you about this. This is obviously a map of the United States, and oh, shoot, I didn't mean to do that. Well, I'm pretty spastic at the moment. Try this again. Okay. Here we have Nebraska, which has somewhere the 5th to the 7th highest incidence of pediatric cancers of all the states in the United States. And so we were curious to find out why. And in order to do that, we took advantage of the fact that we're a college of public health. And well, here is just someone else's map of, this is by counties, as you can tell, of the incidence of all pediatric cancer. And so you can see that. And then you can compare it to this of pediatric brain cancers, because pediatric brain cancers are the highest, the most prevalent kind of pediatric cancers in the in Nebraska. They make up almost half of the brain cancers, almost half of the pediatric cancers in Nebraska. And so, and you can see they're not evenly distributed. There are some counties where the incidence is high, and then these counties actually, the numbers are so low and the populations are small enough that we can't even calculate anything for them. But anyway, that gives you a sense of it. So in order to study this, we used some of the tools that we use in public health. And so in looking, these are our aims for public health, to monitor for things and to do research and educate people, and then contribute to a dialogue about what's the best way to maintain the best health for a group of people. So it wouldn't be public health if we didn't talk about epidemiology, which is the science of trying to understand illnesses in populations. So, and this goes back to the story of the founding sort of epidemiology as a discipline goes back to a physician in London in the early 1800s whose name was John Snow. And that name may make you think of this John Snow, but unfortunately it wasn't that John Snow. It was this John Snow, who's not nearly as handsome. So he, by the way, also was one of the very early physicians to use and to develop anesthesia for operations. Before that, you know, you just sort of gritted your teeth, and or maybe they gave you enough alcohol that you passed out. But so there was a cholera epidemic in London in the 1830s, and it baffled everybody. And at that time, the prevailing wisdom was that it was caused by something called a miasma in the air. Nobody really knew what that was, but that was a good term. And that's what the leading physicians thought. Well, he thought about it. He didn't believe that. He thought it was caused by water, because they were just understanding about microorganisms in water, and that's where he thought it could be. And nobody really believed in him much, except for this guy whose name over there, I forget his name. He was a minister in this area around Broad Street in London. And so he helped John Snow. He wasn't too convinced that John Snow was right, but he thought he should help him see if he was right. So what John Snow started doing was mapping where the cases of cholera were. And he realized, this is Broad Street, and he realized that they were highly congregated in this area. And his study was also helped by the fact that there was one woman who had lived in that area who was a housekeeper for some wealthier family out in the suburbs someplace, and the wife of the family died, and then the husband married this woman who had lived on Broad Street. But she really liked the taste of the water that came from the pump that's right here on Broad Street. So she had other servants come and get water from that pump every week. She developed cholera too, so that helped in this puzzle. But to make a long story short, he realized that it was the water from this pump, because that's where the cases were congregated. So he did a simple thing was he took the handle off the pump. So nobody could use that water anymore, and people would have to go to a different pump to get their water. And sure enough, the cholera epidemic cleared up. And it also proved his point that it was the water from there. Eventually, they realized that the water was contaminated from sewerage that was flowing into the Thames River nearby. So that was really the beginning of epidemiology. And if you ever study epidemiology, you always study this story. And I wanted to tell it to you because it's a clear case of a guy that had knowledge, but he really did a lot of critical thinking and reasoning, and he wasn't afraid to tell the other people that he didn't think they were right, that he thought his approach was correct, and then to prove it, which was kind of the end of that particular story. So this is what we're kind of trying to do these days with looking at the high incidence of pediatric cancer in Nebraska. Our hypothesis is that perhaps there's a relationship between agrochemicals in surface and groundwater in Nebraska related to this high incidence of pediatric cancer. We chose to study nitrate and atrazine as two kind of sentinel kinds of agrochemicals because we couldn't study everything with the tools we had, but we decided to start there. And we began looking in particular, I'm going to talk to you most of the time about nitrate, excuse me, because that's where we have the most data. And obviously, you know the sources as well as I do. Our concern in particular has been rural families with private wells, because as I'm sure you all know, private wells are unregulated in the state, and so they don't get tested unless the owner decides chooses to get them tested. And so, and the wells are using groundwater as their source. So we need to look at both groundwater and surface water. So the first thing we did, I'm not sure that's the next slide. That may not be the next slide. No. Okay, so nitrate, as you may or may not know, has been associated with a variety of adverse health effects. The most well-known one is methemoglobinemia or blue baby syndrome, and that is actually the ailment that the EPA set its limit for how much it can be in safe drinking water, but there are other issues, as you can see, there's other things that it's been associated with. In addition to problems in children, we have health issues in Nebraska, not in Nebraska, in adults, and the studies have been fairly consistent, not 100%, but out of the data that's in the literature, you know, you can see almost all are positive. These are all, those are all, and so on. So there's a preponderance of evidence about a relationship between high nitrate exposure and these illnesses, but it's not a cause and effect relationship. I want to make that very clear. This is an association. Then in children, in addition to the methemoglobinemia, we have these kinds of cancer in children. That is some of the evidence that nitrates are causing health issues. Now, I want to point out, now EPA has set this limit of 10 milligrams per liter in drinking water, but you can see that there have been reports of private wells with much higher levels of nitrate. And in addition, there have been a few studies showing adverse health effects with lower levels than 10 milligrams per liter. So we think that probably 10 milligrams per liter is too high a level for an association with long-term exposure to nitrate in drinking water. So these are the most vulnerable people, as you can imagine, from the kinds of ailments that I've been talking about. So let's go on and look, I think, at some health concerns in Nebraska. And all right, so this is the first thing we did, actually. We got the data from the Nebraska Department of Health and Human Services. We're really lucky in Nebraska that since 1987, there's been a cancer registry in Nebraska, and physicians are required to report new cancer cases to the registry, so it's a good source of information. We also did it for birth defects, but I'm not actually going to talk about that today. So you can see from this, now, here we're not going by county, as you can tell. We're going by watersheds. And because we thought that made more sense, because counties, I mean, they have a political, there are political realities, but in terms of geography and all, they don't really, it doesn't make any sense to us to look at this by county unless that's the only way we can get the data. So we began looking at watersheds, and if you're not familiar with watersheds, you know there are various levels of watersheds. You could talk about the Missouri River watershed, where water all flows eventually into the Missouri River, but that's not very useful for something like this. We ended up choosing a watershed level where there are about 75 of them in Nebraska, as you can see depicted there. And what we found was that, as you can see, there are areas like here, which have high incidence, the highest incidence of pediatric cancer. They're spread around the state. And then lower levels, these that look, it always baffles me that they look like yellow when it's really white on the computer, but that's how they look. Those are areas, again, where the population is so small and the number of cases is so small we can't calculate anything reliable. So those are just really zeros. They're just not calculated. But anyway, you can see that this varies from one watershed to another. So the next thing we did after we got that those basic data put together, we looked at water quality data from the sources that we could find over the same time period of 1987 up to, I think our data go through 2016. And we got them from what was EPA's STORET database, and also from some numbers from the USGS that they have in their database, and then from the Nebraska Clearinghouse. And we put all these data together to look at both nitrate and atrazine levels. Now, I can go ahead and tell you the problem with this approach that gives us some pause is that water sampling isn't done. I mean, they weren't doing this for us. So water sampling, it was happening in various locations at various times, depending upon whatever some agency wanted to do the water sampling. So the data are very spotty. You can have areas that were maybe surveyed once every 5 years, and then maybe for a period, for some reason, they were surveyed sampled every 3 months. Or, so it's spotty data and not very satisfying in that regard. But that was the best that we could do. So, well, we continued on with these studies because we decided, in addition to looking at pediatric cancers as a whole, we would also look at the most prevalent types, which are brain and other CNS tumors, which are in this map. This one is leukemia, and this one is lymphoma. So what is obvious here is that, and the pink areas, the incidence is above the national average, while the green is below the national average. So it's really obvious that this is the prevalent kind of cancer in pediatric patients, and that's actually what's driving our incidence to be higher than, near the top. So we thought that this map looked a lot like maybe the map of corn and soybeans in Nebraska, and that's what is depicted here, where these are green and black dots. I don't think the black dots show up well, but the green ones do. And that's where corn and soybean are grown predominantly in Nebraska. Over here is wheat. And as you know, the implication of that is that the agrochemicals used will be different. And we did try to see whether this part of the state, since it seemed to match all these green areas or pink areas, that whether there really was a statistical correlation between the high brain tumor levels and the use of these agrochemicals. And we didn't find it. Statistically, that didn't work. But there's still, certainly, the maps are kind of similar. So we got that far. We realized that we needed to probably look more closely at some of these and not these watersheds, and not just look on the watershed as a whole. But I will show you, you can see here that this incidence of brain and other CNS tumors is significantly higher than the national average, whereas for leukemia and lymphoma, they're both right about the same as the national average. So we have chosen then to focus on this kind of tumors and see what we can learn. Now, here we had to do this one by county. This is looking at groundwater, and if you go back to this map, you'll see there's some correlation. It's not by any means perfect between the areas that have high nitrate levels in the groundwater and also have high incidences of brain, in particular brain tumors. That's in the groundwater. I guess I didn't put the map for surface water in here because we're mostly concerned about the groundwater because it's what people consume out of private wells. But we decided out of this that we needed to focus in depth in particular areas. So we picked some areas like the upper Elkhorn watershed and the lower Elkhorn watershed and the upper Big Blue watershed, where the incidence of CNS tumors was above the national average, and we also knew that the levels of nitrate were also above the national, at the highest levels. And then we picked some other areas to study where we knew that the levels of nitrate were lower. All we've gotten to thus far, we have data from lower Elkhorn and upper Big Blue. We've been working with the NRDs in those two areas who've been very kind to gather water samples for us, which we are now analyzing, so I can't tell you any results from that because we're still analyzing the samples that we got from last summer. But we decided that our goal would be to try to analyze water samples from locations where children who had pediatric cancers had lived. We haven't, I'll be honest with you, we haven't reached that goal yet because we've had problems connecting with the families and having them want to be in our study of domestic water. This is water taken out of usually the kitchen, the faucet in the kitchen, before any kind of filtration is applied to it, if they have any kind of filtration. That's that. You might say, well, what's the point of looking at water now since these children already had cancer? That doesn't really make a lot of sense. However, we decided it was a valid approach for now because the population in these rural parts of Nebraska is pretty stable, and the use of the land is pretty stable. So we're kind of guessing that any contamination in the groundwater that's there was probably there previously. So this is we think this is a reasonable first approximation. So that's what we're doing about that. Now, we also have, I want to show you a little data about atrazine in ground and surface water. What you can see is that looking at atrazine in groundwater, and so this group one is where it's low, the areas where the level of atrazine is the lowest, and then this goes up to the areas where it's the highest, and you can see that the incidence rate climbs dramatically compared to these low levels of atrazine, most dramatically for brain and other CNS tumors, and also, but also for the other two kinds of tumors. So again, we see an association. We're not claiming a cause and effect here, but we do see an association. And this is some maps showing groundwater and surface water, and I think they're a little hard to interpret, but we'll go through them. So these darkest areas are where the age-adjusted pediatric cancer incidence is the highest, and then these heavier lines here are the highest level of atrazine concentrations, and then these less heavy, these lighter little lines are where it's low. And certainly there's not a direct correlation between these two things, but you can see that a lot of the areas overlap. That's with groundwater. There's also the same story with, to some extent, with surface water, although it's not as pronounced as here, where you've got a lot of areas with the lower concentrations of atrazine. And that's as far as we've gotten in these particular studies. We are thinking, though, that this does give us enough to talk about nitrate as a risk to human health, to contribute to the conversation by a lot of other people with other kinds of studies that have made this point, and we're trying to figure out the way to target at-risk populations, and continue working with that. We'd like to help the NRDs in particular promote a message to people with private wells that they need to get them tested. We know that they work hard to get this message out, and we'd like to be able to contribute to it. We are concerned, on the other hand, about with the nitrate story, that trying to get nitrate out of the water is a significant burden, either to homeowners or to small towns that have water systems. It's a big financial burden, and however, on the other hand, the illnesses that may come from exposure to high nitrate levels also are a really big financial burden to people in the state. You can see this out of a Wisconsin study. We certainly would support the state, if not the federal government, helping people. And I know that at least up in northeast Nebraska, in the Brazil area, that there are programs to help people with checking their water, their domestic water, and if they need it, helping them with the cost of putting some kind of filtration or reverse osmosis kind of cleanup on their water. So we hope that perhaps one day Nebraska will actually regulate private wells and test private wells more routinely. And we think from our data and from the other papers that have been published about this, that this 10 milligrams per liter level of allowable nitrate in drinking water is too high, because there's accumulating evidence of a variety of illnesses that are being associated with drinking water that has that level of nitrate. So what we found is a positive association between nitrate levels in 3 major types of pediatric cancers in Nebraska, and we think there are some policy changes that could reduce this problem. And I do want to acknowledge the people who have helped us from the Lower Elkhorn and the Upper Big Blue NRDs, and we've had funding from a variety of avenues, including the Pediatric Cancer Research Program, which is supported by the state of Nebraska. And I thank you for your attention. I'd be glad to answer any questions.
Thank you, Dr. Rogan. That was very informative. For the people in the room, if you have questions, raise your hand and I'll bring the mic back to you. And if you're on Zoom, we'll get to your questions in just a second.
I guess I'm wondering if there are filtration systems that local homeowners can install, like an ozone kind of filter, or does that not work? Or does that have to be a particular kind of filter? And then I'm always curious that we don't talk about nitrites, which supposedly are in preservatives often, or in preserved food, or whatever we're going to call it. So I'm curious that we're only dealing with nitrates and not nitrites. Those are my two questions.
Yeah, okay. I'm sort of using nitrates as kind of a shorthand here, just for what we're looking at in the water. We're not trying to get into nitrites that would be in processed food and things like that. Actually, you make nitrite, within yourself. It's in saliva. And so at this point, we're only focused on the water sources. Certainly diet also plays a role here. I wouldn't deny that at all. I believe that the most effective ways, but this is really not my area of expertise, actually are reverse osmosis kind of water cleanup devices. I'm not so sure there literally are filtration devices that are going to get soluble things like nitrates or nitrites out of the water. But I know that there are, maybe I better generalize it and call it water purification systems that can be put on domestic, that are put on domestic water supplies that will help with the situation. The problem, the programs from I think the NRDs to help homeowners put these on their domestic wells is they get help putting them on, but then you can't just put it there and okay, it's there and it's just going to work, because you have to keep it in good shape, and you have to also replace cartridges, things like that. So it's not a no cost to the family kind of a situation.
Thank you.
Thanks, Dr. Rogan. That was really informative. I have a question about methemoglobinemia. Do you know, does the state monitor those cases in Nebraska? Do we have any information about the incidence of methemoglobinemia in this state?
I don't know whether you mean like monitoring them to see if they're particularly high in a particular region, that particular area?
Well, I'm just curious if that's a reportable illness to DHHS, like flu or cancer statistics.
I don't think it is. I don't believe it is, because the truth is it's pretty easy to correct. You can in a newborn you can fix that in a matter of a few days. But you would then need to be sure that the infant isn't getting re-exposed to more just make sure they're not getting exposed to nitrates, but continuously. But no, I don't think it's monitored.
Any other questions in the room? Okay, so if you're on the Zoom call and you have a question, if you would raise your hand, and then you'll be able to speak into your mic, and we'll hear your question, and I'll call on you. So let me check the call. Oh, we have some in the chat as well. So I'll start with one question in the chat from the Zoom call. Is there any place we can go to get handout information? I would like to have something that I could hand to people, brochures or something like that. They're just someone who's trying to spread the word about this issue.
Okay. I'm really reasonably sure that the Lower Elkhorn NRD has materials on this. If nobody, maybe other NRDs may also have information on this. We've published some papers, but you probably don't want to give somebody a scientific paper. And so, but I know that this is a big concern to the NRDs because we've talked to them, and I think if you talk to your local NRD, you would be able to get some material.
Great, good answer. Those are all the questions that I have listed. Oh, here's another one. Thank you. Do you have any information about the incidences of Parkinson's disease in Nebraska?
That is another good topic that I think would be really interesting to study. So we got the Parkinson's registry, because again, there's a great registry in Nebraska for Parkinson's. We got those data, and we actually had a student who worked on it for a summer, and then pretty soon noticed an odd thing in the data. I'm just telling you the story how it happened. That according to the data they had, suddenly in 2015, the level of Parkinson's cases started dropping, and then in 2016, they practically disappeared. And we said, this is ridiculous. That can't be correct. So I contacted somebody in the epi department at DHHS, who told me, oh yeah, we got busy. We're not putting the data in. So that we left it at that. The student was just there for the summer, and we haven't done anything with it yet. So then we tried to get an updated version of this, and DHHS went into a big period that lasted about 3 years of saying, no, we can't give you any data. It's illegal for us to give you data. And implied, although they wouldn't directly say it, that we should never have gotten the data in the first place, which I don't think was correct. But they have now resolved that problem, and we're about to ask them to give us the updated data on Parkinson's, birth defects, and pediatric cancer. They can now go all the way up to 2019, and we're hoping to get some more students that can work on that project, because it's just a matter of the Parkinson's data. We have whatever water data we have, and we can do that. I think it would be a fascinating, a very useful study to work on. Our group, I mean, this is really a good thing. We had 2 great Masters of Public Health students working on this, and we had 2 great Ph.D. students working on this project. And they had actually started as MPH students, and then they became Ph.D. students. And it was a wonderful, very a productive period of about 5 years for the project. And then they all graduated. So we are a little short of student power right this minute. And so we're gathering ourselves up to get started again. So I don't know who asked me about Parkinson's, but that is a great topic that we really hope to address.
Okay, thank you. I have another online question, wondering if you could go into detail about lowering the MCL to 3 milligrams per liter.
I just thought 3 looked like a good number. Looking at the data from some papers, some of the papers that I referenced there, I couldn't give you a solid rationale that 3 is the right number. It just seems like there are studies with where there's 5 milligrams per liter of nitrate, and they see an association with one kind of adverse health effect or another. I think it would be better for everybody if the limit were lowered, But as soon as I say that, I've got to say that small communities and homeowners, everybody would need help, government help of some type, to make this financially available, reasonable, because it just, particularly for the small towns, it just costs too much to have the equipment and use it to lower the cost of producing satisfactory water.
Okay, thank you. Do we have any other questions from the audience in the room? Yes, I'll bring the mic over to you.
Hi. I was wondering if other states were reaching out to you, or if you were reaching out to researchers in other states to expand this research beyond Nebraska.
I've talked with a guy, someone in Kansas who was interested in collaborating with us. We haven't tried to do that yet. When we started this, we had this grand vision of not just doing Nebraska, but we were going to do several states around us. And the first thing we discovered when we talked to the Kansas Department of Health, whatever they exactly call it, was that they were going to charge us some amount of money per case that they told us about in these registries. And we knew we couldn't afford it. I mean, it was just going to be thousands and thousands of dollars. And then we did for a while pursue something happened in Illinois. They said, sure, we'll share our cancer registry data with you. And well, months went by, and in the end, they didn't. So we haven't managed to pull that off. It's a logistical problem to get, and a couple of other states said absolutely not. We'll be glad to tell you how many cancer patients we have per state, but we're not telling you anything more detailed. In fact, you can look that up. That's not hard to find. We're not going to tell you anything. So it's not as easy as we naively thought it would be.
Anyone else in the room before I check the Zoom one last time? For the Zoom, I'll be right there.
I'm just looking for it here, but my understanding is there's been a major study just released. Several organizations have come together to actually do primarily citizen science measuring to really document nitrates. But are you aware of that work that's just been released a couple weeks ago? And is it a valid approach in your judgment that you might be able to use in your own research?
I didn't mention that. I should have mentioned that. Now, none of the data I showed you here came from citizen science, but we have been doing citizen science probably the whole time we've had this project going. We haven't mixed the two kinds of data together. We've done it. In fact, Alan Kolak did a project. He had 200 people along the Mississippi River that measured, I think, nitrates and atrazine one Saturday morning, was several years ago, and he published those data, and he and Shannon Bartelt Hunt have done several projects using citizen science where it uses little dipsticks like you'd use for pH paper, and you get a color reading. I was part of a very interesting discussion back in early December at a meeting where one set of people said, well, there's a kind of an instrument you can use, and you can just put it in there and it'll read the color for you, and you'll get an accurate reading from the color on the dipstick. And then the other half of the people there said, well, that's not exactly true, because that's very influenced by whether you're in a lighted room or you're in bright sunlight or you're on a cloudy day. That varies it. And then the other people said, Well, it's better than, when I look at this, I can't tell with my eyes exactly what the color is. So there was a big debate about what the best way to read those. Shannon and Alan published a paper, 6 or 7 years ago, I think now, or maybe at least 5, in which they did a study. They took water, they trained people how to use read the colorimetric strips, and they compared those results to actually measuring it in the concentrations in a lab analysis, and they found that if you train people right, they could do it as successfully as in a lab analysis. So, yes, that is a great way to get more results, because it's a lot cheaper, but it's also you can get a lot more people. And we have had projects with high school students, even junior high students, to do projects like this. But I will have to look for this paper that you're referring to, because that sounds like a much bigger.
I'm looking all over. I don't know why I'm not coming up with it. I've gotten a lot of it. GC Revolt is one of the organizations I know, but they were in collaborations with several others. They just released it. I don't know.
I will look for it. Thank you.
Yep.
Well, I thank you all for your attention.
Thank you, everyone. Let's give Dr. Rogan a hand.